speaker is Dr. Vivek Pandey from College of Medicine, Department of Physical Medicine and Rehab. And he is going to speak on neural jumpstart, restoring autonomic function after SCI. Dr. Vivek Pandey.
Thank you. Hello everyone. Imagine a person driving back home and suddenly got into a car accident. Now life changes. The spinal cord is injured, brain cannot properly talk to the rest of the body. People with spinal cord injury not only lose mobility, but they also face autonomic dysfunctions such as irregular heart rate, blood pressure. They lose control of bowel, bladder and sexual function. When they face these challenges, they not only lose their independence, they also lose their dignity. The biggest challenge in SCI patients is the irregular blood pressure. In the same day, same patient can have higher blood pressure more than 300, or next second it can drop below 50. This irregular blood pressure changes in the same person, same day can lead to the seizures, organ failure, stroke or even death. No medicine can control this highly fluctuating blood pressure in the patients. That's where spinal cord stimulation comes in. Think of it like jump starting a car battery. Small electrical pulses wakes up the neuronal circuits below the level of injury. In fact, when we reviewed 60 preclinical and clinical research, we found that these stimulations improved cardiac, bladder, bowel and sexual functions. Interestingly, there are more human studies present than animal, showing how quickly it moved to the clinics. But here is the catch. Most of the studies used epidural stimulations, which requires surgery to implant the electrodes inside the body. It works, but it has several disadvantages, like it carries several risks, it is costly, and it is invasive. That's where my lab comes in. My lab is interested in transcutaneous stimulations, which does not require surgery. Think of it like wearing an insulin pump, because the electrodes are placed over the skin on the spine. It is safer, low cost and clinic friendly. So the take home message is that spinal cord stimulation works, especially the transcutaneous one, and when we restore cardiac, bladder, bowel and sexual functions, we are not giving people their independence back, we are giving them their dignity back. Thank you everyone.